Last year, a good friend of mine went to a mass PSA testing and as a result was diagnosed with prostate cancer. That test probably saved his life. I'm here today with Graham Fulford, who has started a charity which has helped many thousands of people in a similar way to my friend. Graham, tell me, what made you start the charity?
In 2004, remarkably within probably a month, we found out that a client who'd become a close friend of mine was diagnosed with prostate cancer at the age of 56, and our brother-in-law was diagnosed at virtually the same time. He was about 10 years older. Sadly, both of them were found far too late with advanced inoperable prostate cancer. And whilst our brother-in-law survived somewhat longer, nevertheless, his end was very unpleasant. He spent the last 3 months of his life in a bed in his lounge with his wife sleeping on the floor next to him. He had creeping paralysis, resulting in her having to manually evacuate his bowel 3 times a day with her fingers. So if you are in any doubt, chaps, about the importance of getting yourself tested.
So 15 years ago, what type of testing would have taken place for people approaching retirement age?
Luckily, we were introduced to a chap called David Baxter-Smith, at that time a practicing urologist at Kidderminster Hospital. We asked him what was best, and he said, whilst it's far from perfect, the only thing at the moment is a PSA test. So we organised our first event at the Spa Centre in October 2005. To our amazement, over 200 men turned up, and in actual fact we had to turn away about 150.
Blimey.
So we organised another event quite quickly within a few weeks to pick up that backlog, and to our amazement, although not to David's, 2 cancer finds came from that.
Prostate cancer is one of those diseases that doesn't really announce itself, does it?
It doesn't, and I think men unfortunately are somewhat circumspect. Heads in the sand is a expression I commonly hear used. Things have dramatically improved in the 15 years we've been working on this. There is now a lot more awareness, thanks to people like Prostate Cancer UK and others, and to awareness programmes put out by people like Bill Turnbull and Stephen Fry. Interestingly, when they both went public a couple of years ago, we found events that we were involved in, the attendance levels went up probably at least 50% as a result of that public knowledge awareness, shall we say.
So are other countries in a similar situation where this is a creeping disease?
It is. I think it's a worldwide situation. I mean, the facts are the facts, you can't get past them, but I think the UK does lag behind the rest of Europe, sadly.
It's not an unusual cancer, is it?
I think it's the second biggest cancer killer in men after lung cancer. It is a disease generally accepted to be for older men, but we are finding cancers in men in their 40s and 50s. And I think like every single cancer, the earlier it's found, the better chance of survival.
And what do doctors feel about prostate cancer and the way that it's diagnosed?
Well, the PSA test isn't the perfect test. We are fully aware of that, and we are fully aware of the arguments that have been put forward. I think a lot of those now are discounted. Things like the National Cancer Audit are now showing that the likelihood of overdiagnosis and overtreatment has fallen from 8% to 4%. Our findings are that a lot more men who are diagnosed are being put on active surveillance rather than some active intervention.
But now, 15 years later, you must feel that you've genuinely saved lives.
I think that is the case. Yeah, we're very proud of what we've achieved. An awful lot of people have helped me get there, not least my wife and the team that has supported us over the years. And I've met some wonderful people. Right at the end of this little video clip is a list of people I've had the privilege of knowing have lost their lives since. They've all battled prostate cancer very, very bravely, or a lot of them have. And yes, I mean, we're now up to something like 150,000 tests across 75,000 postcodes in the UK.
Really?
A fact we're very proud of. It's covered about 100,000 men because some men have been back for multiple tests, and we've now found over 2,000 cancers.
Wow.
So in pure statistical terms, we find a cancer in every 50 men that we've tested.
Many.
So in real terms, of those 2,000 cancer finds, 1,400 have needed some form of formal intervention. Many of those will be life-saving, and for others, whilst it'll still have been found too late, sadly, it will have improved their quality of life and hopefully given them more years of better quality life with their families.
Tell me about PSA velocity.
The accepted, shall we say, normal, in quotes, levels of PSA will rise about 1 every 10 years. So at 50 you would expect it to be a maximum of about 3, and at 60 it would be about 4, and so on. So therefore, if it's increasing at a rate that indicates you're going to go through these thresholds earlier than that, then clearly that is an indicator. Our argument would be, how can you ever find out what the PSA velocity is if you don't start with a score somewhere and then review it every few years?
So by 2014, trying to put together an IT system to handle 40,000 results, I mean, that's a massive task, isn't it?
We worked on a program that, given the number of tests that we realised we could computerise per hour, it would probably take us about 18 months or so to do.
Okay.
We were very fortunate in that one of our nurses who'd helped on the testing side, Wendy Hodgkinson, joined us along with my brother-in-law, Steve Valentine, and they sat down together and religiously worked through all the past results on a day-by-day basis, hit the target 3 months early.
Once the system was up and running, how many tests were you running a year?
By this time in 2016, we were probably running at the level of about 15 to 20,000 tests a year.
Surely there must have been bottlenecks in that system.
By 2019, we realised that our sort of target of getting back to men within 7 to 10 days of having had a test with us was at breaking point.
So tell me about Susan Hart.
Susan comes from a very strong background in terms of use of IT and marketing. And I said to Susan on day one, if you were starting with a clean sheet of paper, Susan, what differences would you make? And her recommendation was that we set up a sort of personal bank account of your PSA scores to date so that men could access it any time. They could book an event through that same system and make the whole thing streamlined. Probably the best thing we ever did.
That must have been a mammoth task.
It was a major task. We did set ourselves a very tough target of 5 months. The other huge advantages of the system are that they get an email confirmation immediately once they're booked. They get a further email confirmation on the day to remind them. And last of all, they get a text message a few hours before the event as a final reminder. The other beauty of the new system is that men have access to their PSA account at all times, which they can share with their GP.
Tell me about the traffic light system.
From day one, we operated a traffic light system of green, amber, red. The green letter effectively says your score is normal for a man of your age, but because the test isn't perfect, you should look out for symptoms such as going to the toilet too frequently, especially in the night, or problems voiding. The amber letter says that your score is very marginal, so we would recommend that you check yourself again within the next 12 months or so. The red letter says your score is abnormal. We go to great lengths to point out that, because we don't want to cause undue worry, that 75% of those red scores will be for a perfectly innocent reason, like a urine infection, but it is strongly advisable that they contact their GP for a follow-up review.
That must have been so frustrating. You've got this all up and running, and then along comes COVID.
Yes, we were very frustrated with the COVID interruption, shall we say, because after the relatively quiet run through February, where we ironed out teething problems with the new system, it had been very, very well received. And in fact, literally a week before we had to close down for COVID, we had an event which Susan and I attended, very ambitious, well over 500 men attended, huge success because they knew exactly the number of nurses they'd need. Nobody waited longer than 5 or 10 minutes, and all men and probably got their result within 4 or 5 days of the test. So fantastic success. The word was getting round. We'd probably booked 60 to 70 events from April onwards through to September, October. All had to be suspended because clearly it was just far too risky.
Has there been a silver lining to the pandemic?
We've always wanted to introduce a home testing kit for men who couldn't attend an event for one reason or another. It was launched very successfully after a pilot of 100 in June, and we have now already carried out over 5,000 such tests in the 3 months since launch.
Can you tell us how the charity will move on post-Covid?
We're very excited. We now have effectively 3 strings to our bow. One is the traditional events. Secondly, we have the new home testing kit option, which can be bolted alongside it. And thirdly, we have corporate testing, where employers are now starting to realise the importance of looking after their male workforce.
Can you tell us about your team?
We're very lucky in that we have 3 totally committed people working for us at the minute, in that Susan Hart is our general manager, and working very closely with her we have John Young, who comes from an IT background, and also Wendy Hodgkinson, who is effectively a retired healthcare assistant who does a lot of our nursing. We're very mindful of the fact that we want to provide a very quick response service to anybody, and for example any query or concern we try to deal with within 24 hours.
Right.
We're great believers in answering the phone rather than you pressing a number and getting a bit of music.
I understand you're doing something with Manchester University, looking at diagnostic pathways?
Now that we've got an even bigger database, we're all very hopeful as a team that using their expertise, we can make an application to the National Screening Committee about the importance of a national screening programme.
I've heard you say the PSA test is not a bad test. It's a good test if correctly used. I get the sense that there's an imperfection here.
There is much discussion about the validity of PSA testing, and we are fully aware of the need to distinguish between indolent cancers, which can be left and just actively surveyed, as against aggressive cancers, which clearly need some form of intervention. We're delighted to see that there's really good research going on from people like Angle PLC in Cambridge working on a liquid biopsy, and also Nottingham University working on a similar basis using AI algorithms.
So in a nutshell, what would you say to someone who's never heard of a PSA test?
I'd say please visit our website, read all the information that's available, seriously think about it, chaps, and remember the opening comments about the distress that Peter lived in the last 3 months of his life, and seriously consider not putting yourself through that.
Well, all the information you could possibly need is on the website.